Omicron is reportedly sending authorities back to the drawing board with regard to containment strategies as they attempt to tackle surging caseloads. For more, I have Professor Yu Byung-wook from Suncheon University. Hello, Professor Yu. Welcome back. I also have Professor Kim Moon-gyu from Yonsei University. Professor Kim, it's a pleasure to see you again.
Good afternoon.
Right, Professor Yu, U.S. health authorities are reportedly looking to upgrade their mask policy and urge people to avoid cloth masks, which were quite common during the Delta outbreak there. Is Omicron perhaps undermining the effectiveness of our face masks?
Well, I have some agreement of that, and also I have a little bit of the disagreement of these policies. Since the beginning of the COVID crisis, Korea will suggest wear the mask strictly is also level at least some of the high number of this, because virus couldn't see the very small particle can be transmitted anywhere. So which we use the cotton mask types one, doesn't help. So we need a surgical mask or at a certain level of the mask we have to put on. But I fully understood because European people and North American people have the think of a mask mean resistance. Because I loved this movie, the V for Vendetta. So this movie say undercover their identity to resist with the poor and political power. That's why Asian peoples wear a mask mean the protects personal from the certain virus, but European people and certain Western cultural mask mean the resist. That's why they don't want to wear the mask anyway. That's why the U.S. government and their Public Health Authority recommend different type of mask. Anyway, you have to wear a mask, but from the beginning, never changed. COVID virus can transmit it. So if you will not wear a mask and not prepare, wear a mask neither. So we need a certain certified and qualified mask put on can be prevent COVID-19.
Right, and these certified face masks, of course, you're talking about is the KF94 or the KF80 or the KF-AED masks.
Absolutely.
Right. Professor Kim, do tell us a bit about the most effective way of adorning a face mask.
Well, that means we have to go back to the basic. Everybody knows how to do that, but if we put on CCTV on our face or hands, I think everybody's going to need a re-education how to wear and put down the mask. So we should not touch the mask itself, but the string. And whenever you try to put on or take off the mask, you should not touch the mask itself. I think if we go back to the lesson we had from the Spanish flu 100 years ago, any kind of mask is better than doing nothing. But I strongly recommend the KF94 or higher because we are entering a Omicron variant season. And there are two reasons we have to wear a mask. One, to protect ourselves, and second, we have to protect others. So mask is protecting myself and others also. It is not recommended to wear a mask for many days. I would say that it's recommended to wear less than 1 day, and you have to change it. Problem is, we touch our faces more than 3,000 times a day unconsciously. So you might have a chance that your hands might be contaminated with the virus already in your mask. So I think that's the reason we need a hand sanitizer and we have to wash our hands often. One more thing I would like to mention is the mobile phone. You know, if you don't have a mobile, you cannot enter a restaurant, you cannot go anywhere without it right now. And your mobile phone can be a focus of infection. So I recommend to disinfect your mobile device regularly.
Right, a very valid point there.
Yep.
Professor, UK researchers have reportedly found that the coronavirus loses about 50% of its ability to infect after around 10 seconds or so in the air of a typical office setting. What are the implications of this latest finding?
Which is a very interesting research, but usually we heard the research before. The coronavirus, COVID virus, can be registered in even the paper boxes more than 7 days. Only the years before, the UK, the research they reported, many Korean people are shocked about it because 택배, this is a quick delivery system in Korea. That's why everybody is shocked and we're afraid of touching the vaccine needle, but we forget it. Why? Because virus, there are ability of the infected, yes, around the 10 seconds to the minute, will be very weak and doesn't make the infected properly. But anyway, ventilation is very important because outbreak in outdoor is very rare cases, but most of the serial and the cluster infection is happening in indoor activities. So that this is one of the interesting research, but mainly what the Professor Kim to explain us, we have to follow from the principle. So the mobile device, one of the interesting we have to take care about as well. Let's look to the principle how to prevent it. Wear the mask properly, and also avoid the cloudiness and keep on the ventilation. This is help. But we have to listen to this interesting research report. But we have to keep on the principle.
Right, because the study has yet to be peer-reviewed, though. Professor Kim, it has been found that COVID-19 patients compared to flu patients face greater risks of hair loss and dementia. Could you tell us more about this?
It's a report from the database from Health Insurance Review and Assessment Service, and they compared influenza patients of 2017 to 2018, which was a number more than 200,000. They compared with the COVID-19 cases of 2020. The number was only 20,000, so it's about 10 times less than the influenza. Before making any conclusions, we have to know that the half of the influenza patients was less than 19 years of age, and COVID-19 were older. So if you look at the problems they have, you can easily conclude that that can happen. And when we are exposed to a virus, a virulent virus, there's a disrupted immune response to that initial insult, and that might end up as a cytokine storm, which can happen to influenza, SARS, MERS, and COVID-19. And there are other frequent medical situations happening this. So most of the chronic sequelae after COVID-19 are related to this situation called cytokine storm, mostly affecting the lung. I do welcome this report from this Health Insurance Review and Assessment Service because I'm trying to update myself every time of the reports from Israel, because the same kind of research they do and they put out, and it's a global hot news topic because everybody is interested in what's happening in Israel because they are the front leader of vaccination. What happens after the vaccination, and do we need the third shot or even the fourth? So if we can have our own data of South Korea, it is mostly welcomed, and I wish that we can be brave enough to share information more quickly so every doctors can understand what is going on and what to do next.
Right, of course. Professor Yu, some pundits believe that the Omicron outbreak in Europe and the US, as my colleague Suha mentioned earlier, will peak sometime around this month or in the weeks ahead. What is your forecast?
Well, so European countries, they are facing on the record high than ever before, in the US as well. So my little concern is Omicron, even the weak, and then other variants, but can be hit to some people. So this is the time to change of idea and the strategy against the COVID-19, because cannot be avoided 100%, because this is data to show us how we can smartly, run through over these two waves. Because when we are facing on the wave in the ocean, if you get the breakthrough, it's very difficult. How to smoothly turn on the back of the big waves, which means changing of the strategies. How to having this Omicron, because Korea is a big wave is not started yet. Japan is facing on now. So probably after the Seollal holiday, probably Korea will be facing about it. That's why now is the time to change to the strategy and the open discussion with the people and the health authority and medical experts and also general people and also small, medium enterprise learning people. So anyway, Omicron hits wave the same as like US and Europe and Korea soon, but we have to listen how they smartly passing through and how to minimize the victims from this big wave. But anyway, time to change ideas.
Right, and we'll speak more about those ideas in a bit. But Professor Kim, staying with the situation in the US and Europe, now the rampant rebounds in these two places are hindering containment efforts as authorities focus on treatment. This itself is an inevitable reality, right?
Yeah. As Professor, you mentioned, I think it's the time we have to think again. And if I review briefly what happened through this pandemic, first, there was no vaccine, and we have to deal with this pandemic with social distancing, the only plan that we had. And about that time, we understood who are in high risk. So after we got vaccination, the case fatality rate dropped dramatically, and we hope that this vaccine could bring the herd immunity, but it was not so successful, and the breakthrough infection happened. And soon we're going to have a medicine like Paxlovid, and that's a good news. But we are dealing with the Delta variant and Omicron variant right now. So this infection is spreading to a younger age group, doubling every 2 to 3 days. So are we going to focus on the total number of confirmed cases, or are we going to focus on the case fatality, I mean, the high-risk group? If we want to focus on that high-risk group, I think we already know what we have to do and what is our priority. And I wish that the new strategy will be based on scientific evidences.
Right, and talking about strategy and going back to what you mentioned, Professor Yu, how or what proposals do you have with regard to perhaps a shift in our strategy against COVID-19 as we wait for the next outbreak led by Omicron?
Well, fortunately, until now, Korean government depends against the Omicron variants well. That's why we don't have a big wave. Yes, we have time. Yeah, we save the time because European country and US, they just immediately back attacked from Omicron. That's why couldn't handle it, anything. But we have time to handle it. So time to change the idea. First, if Omicron, this is not serious than other variants, let's change the thing to open the discuss with the general people think about this is like influenza. But it's very new influenza. That's why we need a kind of big agreement is the all of the society or different part. So let's start to open it. Don't count the positive cases every day, but the government be noticed a weekly basis the cases of the victim. I'm sorry about the victims, and then we highly recommend to the enforcement of the vaccination later for the risk groups. Anyway, also some people who are fully vaccinated fully follow the Korean government regulation. Yes, still keep on free, but who have their own idea because own decision, wear a mask, have a vaccination, yes, it's a free own will, but who are out of regulation, but if a case of the confirmed case of COVID-19, response of this is a personal. Change the idea, change the mind. Because government doesn't cover to influenza patients for all. Yes, that's why government recommend for more than 65 years old over and less than 12 years younger, having their good opportunity to have a free vaccination for influenza, and we followed it. Most of, not all. Why? Clinical decisions from the expertise and the big policies from government and the health authority and political power, but people will not follow it, useless. So, time to open discuss to how ways is this COVID-19, especially Omicron variant or further, it's like dealing with influenza or not. Yes, first step is not easy because criticize will be started, but must be turn on the first stone on the stage should be. So I'm ready to put on the first stone in the stage.
Right, I
Yeah.
see. And hopefully the members of the public will make informed decisions.
Yeah.
Professor Kim, how do you respond to calls for all medical facilities to be open to treat COVID-19 patients?
I think that's the mention from Professor Oh Myung-don, who is the committee chairman of the new infectious disease. And we have to understand that we are in the same corona pandemic, but the Omicron variant is quite different from the original Wuhan strain. So let's say that it's a different disease, like some kind of a different severe influenza. But in the hospital, we have to follow the strict quarantine measures because we don't want any kind of disease spreading inside the hospital. And as I work in the emergency department, I see many patients visiting the emergency department because the small local clinics refuse to see the patient because the patient have a fever. I think we have to change this kind of thinking to a new era. I would say from pandemic to endemic. We need a new consensus that the best efforts should be focused on the elderly risk group patients, and we have to find a safe environment for this age group. And there's a big issue about the vaccine pass for students, but if we change our strategy, I think we can change that issue also. As the oral medicine is going to be available soon, I think small clinics can join the fight against this pandemic, just as we did in 2009 flu season. So we have to see what kind of consensus is going to make, how it's going to make.
Right, there are many things to discuss then.
Yeah.
Professor, there are also questions about the adorning of level D protective gear in treating COVID-19 patients. What are your thoughts on this?
Well, the uniforms, they have the message to people. If I wear a mask and wear a uniform like level D, patient, they feel scared, which means this is something unknown virus is coming. I 100% agree with Professor Kim's comments because strains is the scientific evidence that from the beginning, from the China, now we are facing on Omicron is totally different. My personal opinion, it's totally different. So from the beginning, unknown virus, yes, we have to listen from health authority to protect ourselves, and for everybody, level D should be like astronaut protections. But from now on, we are showing the level Ds to the people, mean Omicron and further variant still serious. But if you level down wearing protects, mean people are feeling better. So in one case, when the MERS outbreak, it was 2015, one case is confirmed in the southern part of the Gyeonggi province. Clinic is all the media say that clinic was visited from MERS patient. No one goes. But this day is so Professor Oh Myung-don and recommended to the clinic in the town to start to having the Omicron. We need big agreements about it because so many cases clear, doctor is put on level D and heard that that clinic is visiting the COVID patients, hospital or clinic, no one wants to go there. So level D should be with who are very close in the integral care unit in the cases that, but now time to change the idea, level down, carry down. If this Omicron's scientist basis, Omicron is totally different and weaker than others from the origin, yes, time to change the idea.
Right. Professor Kim, come Friday, that is tomorrow, authorities will announce their COVID-19 restrictions for the days ahead, starting from the 17th of January. Now, there are expectations for current restrictions to remain in place. What are your thoughts?
Well, in the recent situation, I realized that we are getting more ICU facilities right now, and as the previous report, I see that the severe cases are decreasing. I hope that it is not because of they pass away. I hope that they get better, and if we do not have no more new severe cases, that would be a best scenario. Anyway, My hospital is preparing many beds to prepare a big outbreak of severe cases. So, but still, we don't have that manpower to run that facility. So, one good news, but still there are problems that are not solved yet. Right now, I think we have to start a version 2.0 of this quarantine measures and strategy, as the professor you mentioned. And I'm sure that wearing mask will be a key element, as nobody can get free from that. And there should be a strict rules to protect the high-risk groups. And at the same time, we can lose some rules to prevent negative effects of this quarantine, especially on education and economy. And we wish that we can do more outdoors activity if possible. Yeah, but still, hospitals has to keep the current rules for a while. And as I listened to the mention about level D, it's very difficult to maintain that kind of policy inside hospital. A nurse, we need at least one more nurse to care patients if the patients has to, if we have to wear level D. So if that is easing somehow, I think the burden for the medical facility will be lightened.
Right, and the workers there, of course.
Yeah.
All right, Professor Kim, as always, thank you very much for your thoughts today. Professor Yu, thank you very much for your insights.